Ranking Member Kuster, you are recognized for 5 minutes.
Thank you, Mr. Chair, and thank you to our panel, and I particularly want to thank the GAO and the IG for their helpful report. I want to focus in on evidence demonstrating we know what a successful drug diversion deterrence program would look like, and yet we continue to have this problem at various VISNs. And my question is, currently the VA gives authority to the individual facilities to implement these inspection procedures. But is there any reason, and I guess this is for Dr. Clancy, why the VA could not streamline this process and apply one standard to all facilities and in fact have an inspection team based out of the central office that would go out to the VISNs? It seems what I'm hearing is that this is often just an added task. In fact, in one case, it was somebody was a food services worker this was just an add-on. It doesn't seem as though we're taking it sufficiently seriously. And wouldn't it make more sense if we had an office of inspection that would then go out to the VISNs, perhaps, you know, as you did yourself, without advance warning and do these checks?
Well, thank you, Congresswoman. That's exactly what we're going to be looking into. And I think that what we need to look at is how much of this could be done remotely, how much of it requires on-site presence, and frankly, how much can we identify ahead of time which facilities are likely to have the most challenges. I suspect that in some instances, but we need to test this, we will know which facilities are more likely to be compliant. I guessed correctly which one was the facility in the GAO report based on many, many other things I knew about that particular facility, and I wasn't incredibly surprised of the others, but we need to actually up our game and make sure that great policies are implemented consistently. There's no question about that.
And at least have consistency. What I'm curious about is having a system that would be consistent throughout. So I have a couple of minutes. I want to return to the issue of reducing the amount of opiate medication generally in the VA population. We had testimony from a medical researcher that out of the 60,000 surgeries a year, 99% of people get opiate medication, and 1 in 15 will become a chronic user of opiates. And that's what's feeding this epidemic. Can you talk to me more about both the program within CARA, encouraging VAs to reduce the use of opiate medication, or any other examples that you might have in the system?
Of course, and thank you for the question. I'm happy to report that we are on track for all the provisions in CARA. Incredibly enough, VA's portion of that is named for a veteran who died under our care, and I was literally speaking with his father yesterday, and I've been most impressed by the family honoring the experience of their son by working with us to make sure that we provide better care. VA has really been on the forefront of reducing the use of opioids. So beginning in August of 2013, we've seen a 31% reduction in the number of patients receiving opioids. We've seen a 56% reduction in the number of veterans who are receiving an opioid and another type of drug has a particularly high risk for adverse reactions. We are doing much more frequent urine testing because we're trying to minimize diversion from patients, veterans actually selling the drugs that they got at VA to elsewhere. So the right answer on a urine drug screen is positive, that you're actually taking the medications you received. We're seeing the overall dosage of opioids has decreased quite significantly and we've also seen we have seen these results at a time when we've seen an overall growth in the number of veterans we are serving. I want to be clear, we're not done, and we will continue to monitor this. And I'm very proud of the work that we are doing to offer veterans alternatives to chronic pain management.
So my time is up, but I would just say to the chair that as we continue, I'd love to have further testimony about the chronic pain programs and how we can bring down the use of opiate medication. Thank you.